If you don't already have children, there's a good chance that someday you will. For most of you, the birth of a baby will be the happiest experience of your life. But for a few, happiness could quickly turn to trauma. That was the case for my mother when she heaved heavy sobs upon realizing I was born with blue skin. Thanks to the quick thinking of my mom's obstetrician, I was rushed to the Children's Hospital of the King's Daughters to be assessed for cyanotic congenital heart defect. According to the Children's Heart Foundation, 1 in every 100 babies is born with a congenital heart defect. Congenital heart defects kill twice as many children worldwide than all types of childhood cancer combined. According to the Division of Birth Defects and Developmental Disabilities within the CDC, 1 in 4 children with heart defect in the United States is born with a critical, otherwise known as cyanotic congenital heart defect. Of those born with a critical defect, at least 1 death will occur, and only half will be correctly diagnosed at birth. It's important to know the signs and symptoms of those born with a cyanotic heart defect because of those born with a cyanotic congenital heart defect, 25% won't make it to their first birthday, and 31% won't make it to the age of 18. Today I will discuss how the recognition of blue and or pale features, labored and or rapid breathing, and trouble eating can prompt medical intervention, which often results in increased lifespan. First, let's discuss the signs and symptoms. Blue and or pale features. Fingernails, toenails, lips, and skin can all be discolored due to poor blood oxygenation in a cyanotic heart defect patient. Healthy babies' features are normally a rosy pink, but discoloration occurs in a cyanotic heart defect patient because blood is not being sufficiently pumped through the body and oxygenated and deoxygenated blood are mixing within the body. All those born with a cyanotic heart defect will have 1 or more of these skin discolorations. The next clue to a cyanotic defect is labored or rapid breathing. It is marked by noticeably struggling to breathe, being out of breath without exertion, or breathing rapidly. It can be recognized by visual observation and can occur for 1 or more of 3 reasons. Either the heart is beating harder to compensate for poor function, the heart is beating out of rhythm, also known as arrhythmia due to an anomaly, or the heart is beating faster due to an arrhythmia issue. A more difficult symptom to notice is trouble eating. Trouble eating is a precursor to a cyanotic heart defect, particularly in infants. Feeding is considered a normal activity for babies that is typically uneventful. A normal baby, normal healthy baby, can eat 6 to 8 ounces of fluid in a sitting without experiencing fatigue. But a cyanotic congenital heart defect patient can only eat 2 to 4 ounces before falling asleep. For a cyanotic heart defect patient like me, eating 8 ounces was like running a marathon. Most cyanotic patients are only able to eat 2 to 4 ounces per sitting because the patient is physically exerting themselves to eat, which affects their heart rate and beating intensity. But there is hope. Early detection leads to earlier medical intervention. Despite the need for lifelong medical care, cyanotic patients whose conditions are caught early can live well into adulthood. According to the Adult Congenital Heart Association, the number of adults with congenital heart defects now outweighs the number of children born with them for the first time ever. According to the Children's Heart Foundation, of those born with a congenital heart defect, at least half will require 1 invasive procedure in their lifetime. I was born with tricuspid atresia, a cyanotic defect that renders half of my heart useless. I am 31 years old and I was diagnosed at birth. I've had 3 open heart surgeries, 1 when I was 5 months old, 1 when I was 2.5 years old, and 1 when I was 28. So what have we learned? 1 in 4 patients have a cyanotic heart defect. Being able to recognize signs and symptoms of a cyanotic heart defect early can save lives. The symptoms to recognize are blue and or pale features, labored breathing, and trouble eating. We have also learned early detection leads to early medical intervention. for a better prognosis and is important because congenital heart defects are the #1 killer of children over all other childhood illnesses, including all forms of cancer combined. Despite advances in medicine and technology, some congenital defects still go unrecognized due to lack of symptom recognition. Remember the signs and symptoms of cyanotic defects to obtain medical intervention early. Don't let your miracle turn to tragedy.
Thank you very much, and thank you very much for